I have a large dog. His name's Andy. The family joke is, because we had a little dog before and he passed away, and then so the family joke is you wanted a big dog, and so we thought we were getting a 70-pound dog, and it turns out he was a 110-pound dog. So, well, my name's Kim Krahn. I'm 50 years old. I was diagnosed with multiple myeloma last August, just over a year ago.
Hi, Annie.
How's it going?
Good. How about you?
Good. How's your day?
Good.
What you doing?
Just cleaning up my plants.
Nice. It's getting big.
Well, Kim broke her leg a couple years ago at the lake, playing with the dog. She slipped on some ice, and we just thought, you know, it's just a broken leg. You know, she'll get over it. And it turned out to be, we think, a precursor of things to come. She started having other bone pain.
But I just kept telling myself I'm overweight, I just need to lose weight, and then if I lost weight, the pain would go away. And it wasn't going away, it was getting worse and worse and worse, and then I started having rib pain also. And finally I went to my family doctor and I told her what was going on, and then and she said to me, well, Kim, we're not going to figure out what's wrong with you, because I was so vague, I think, with my symptoms. So I went home, and then I was going to work that night. I worked the night shift, and my husband was driving me to work, and I just started crying. I said, I can't go in there. I can't, because I was in so agony. Sorry. So he took me into Emerge. Well, I went into Emerge. And they did a scan, and yeah, all my bones had multiple holes in them called lesions, and lytic lesions, and so my bones were being eaten by myself. My plasma was eating my bones.
My mom started the marches.
Oh, really?
8 years ago here in Winnipeg, and she passed away in 2014. We've met so many beautiful people on our journey.
So multiple myeloma is a type of blood cancer that affects a type of cell called the plasma cell. And the plasma cell's normal job is to make antibodies to help people fight off infections and things like that. And these cells grow in the bone marrow, and as a result of that can cause problems and symptoms that people get when they're diagnosed with multiple myeloma. So some of the symptoms can be pretty non-specific, actually. We sometimes use an acronym called CRAB to stand for the 4 symptoms that go along with it: calcium levels, renal or kidney problems, anemia or low blood counts, and bone problems. So multiple myeloma is a disease that's more common as you get older. So the average age when you're diagnosed is usually in the 65 or 70 years of age category. It's less common in people who are younger. So I would say we know quite a bit, but certainly not everything, and research is very important in myeloma.
Get everybody to grab a balloon on their way out the door.
Yes, we'll do that.
Okay. So yes, it's always bad news and good news. Like you're constantly up and down. You go home and you decide, well, today was a good day. I got good news, and then yeah, there's always the bad news. Multiple myeloma is not curable. It's I'll have it for the rest of my life. So it's constantly, determining what's the best treatment for you, and everybody's different.
The organization started in 2005 by two patients, Aldo Delcal and John Lemure, who were both multiple myeloma patients living in Montreal. And Aldo, when he was diagnosed, there was two things he was looking for. First, was there other patient like him? Was there a patient support group in Montreal? And there was none. So he decided, well, I'm going to start one. So he started a support group in Montreal, but soon realized that, patients across the country needed to be connected. So he started Myeloma Canada. And the second thing he was looking for was information about clinical trials.
After I got diagnosed, I was alone for so long. I mean, I had my family and friends and support, but I didn't have anybody else that had multiple myeloma in my life. And after I had the transplant, I went to a meet and greet with the Myeloma Canada that they had. And first time I talked to somebody was Jackie Labossiere, my friend.
We're both myeloma.
So it was the first time I've ever even talked to anybody and shared experiences about how you're feeling, and it was good. And so there's a myeloma support group. I think we're the third Monday of the month.
I'm just interested in how quickly you got into that clinical trial with the time.
So August, I think it's the 27th, was when he told me I came in.
Being a very grassroots organization, our goal is to reach as many patients as possible, because we feel it's important that patients feel not alone and that they have the support of a patient organizations like ours, either for education material or for connecting with other patients or finding out about research.
Myeloma Canada also supports the Myeloma Canada Research Network, which is really a group of leading researchers in Canada. So that's a really important group within Myeloma Canada as well. And that the Myeloma Canada Research Network develops studies to allow access to newer drugs that are not yet available. So I think that's really important for the care of these patients as well.
Is there a general feeling about it?
I'm a very independent, controlling type of person, and so I think it's hard for me to ask for help. I've learned to ask for help during all this because I can't do it by myself. So I have an amazing support system. My family, my friends, they've been so supportive and bringing me meals. It's been great. Makes you feel so blessed.
Oh, you're so special, my dear. You don't know. I've been bragging about you to everybody.
She's starting a new treatment this week, so we're hoping that really helps, and it's had really good success so far in the clinical trials.
Well, I look forward to this new treatment's working, because I know it will. Because I have to be hopeful, right? I can't curl up, and then my husband's got to take me on a car ride to see some baseball ballparks. That's kind of my bucket list, is to see the 30 ballparks in North America. And I have the passport waiting.